Also, to remind you, please fill in the evaluations. We're really trying to do a good job of evaluating the conference, so fill in your number. I think there's at least one more raffle to come. Okay, so our first speaker this morning is Jinho Choi, who's going to speak about responses, about the human rights status of AIDS patients in South Korea. And I understand you come from the Korea Alliance to Defeat AIDS.
Hi, my name is...
Change slides, please?
No, it's okay. Hi, my name is Jinho Choi. I'm from South Korea with the Korea Alliance to Defeat AIDS. And I'm a high school senior right now at Asian Christian International School.
This way.
Yeah, that's me. And today I'll be talking about the human rights status of AIDS patients in South Korea. And yeah, could you... So before I start my presentation, I would just like to explain a little about the cultural background, so the background of where I'm from. So in South Korea, we have a mainly Confucian kind of social perspective. That is, based on my experience from living in the States when I was young, the United States seems to be a country that's more socially aware and socially open to some kind of issues, such as HIV and AIDS. But in Korea, the public perception of AIDS patients in South Korea is very limited because we hold, basically Korean society holds the principles of Confucianism Confucianism is very ingrained in Korean society. And so people tend to be more closed-minded and not as open to the idea of HIV and AIDS patients, which leads to the human rights of HIV and AIDS patients in South Korea being violated. And I'll be speaking more about that in my presentation. And then so for my background, basically according to Article 11 of the Constitution of South Korea, a person is born with the rights to live as a human being. And the unfortunate thing is that many people in South Korea, especially AIDS patients, are living their lives with their human rights being violated despite this law. And in Korea, the human rights for most people have generally improved over the years as society has slightly opened up to the issue of HIV and AIDS. However, the human rights of AIDS patients have still not improved enough. And yeah, could you move to the next slide? And so basically what I did was I looked at some of the examinations that were done to see how much the human rights of AIDS patients were being violated in Korea. So according to the NHRC, that's not the NHRC we're in. It stands for the National Human Rights Commission of South Korea. So according to this NGO's report in 2005, the human rights and the quality of life of HIV and AIDS patients are significantly low. So what the NHRC did in 2005 was they conducted a survey from October 2005 to November 2005 of 255 AIDS patients in South Korea. And this survey was done to see how much AIDS patients were suffering in relation to their human rights. And basically, they surveyed AIDS patients and then asked them questions on, how they thought, their human rights were being violated in society. And then so I'll be talking more about the results from that survey later on. But basically, the results of the survey showed that the human rights of AIDS patients in Korea were significantly low. So and right now it's in the present 2010. So 5 years have passed, but HIV and AIDS patients still do not believe that the human rights have improved, even though 5 years, which is a significant amount of time, has passed. Not enough has been done in Korea to improve these rights. And then so the study that I conducted, began with the idea that once again, someone would have to make suggestions to improve the human rights of HIV and AIDS patients, because basically, from the survey, the result was shown that HIV and AIDS patients were their human rights were being violated. So this this organization, the NHRC, what they did was they suggested to the Congress and to the government of Korea to change the law in order to improve the human rights. But then many of these human rights, many of these laws have not been changed. And then so that's how I got the idea to once again suggest to the government that some aspects of the law should be changed to improve the human rights of AIDS patients. And then so the purpose of my study is to raise the problem with the human rights of HIV/AIDS patients and suggest ways to improve them by, one, verifying how much the human rights of HIV and AIDS patients have improved. So I just wanted to see, to what extent the human rights of AIDS patients have improved over the time of 5 years. And then two, I just wanted to suggest 3 ways to improve these rights. And then so this is my study method. And my study method consists of the following. 1, a literature review of the human rights of AIDS patients in Korea. 2, violations of HIV/AIDS-related laws based on the results from the NHRC study in 2005. 3, a survey and interview of current of HIV and AIDS patients in the present and their human rights status. And then 4, some suggestions of ways to improve human rights. And then so this graph basically it just shows the number of HIV and AIDS patients in Korea. So in 1985, which was when the first AIDS patient in Korea was found, there were 517 patients. And then this is the number of deaths. The number of patients accumulated over time. So in 1985 to 1995, there were 517 patients. Then 1996, there were 622 total. And then it's basically an accumulation. And then currently, as of 2009, there are 5,671 AIDS patients that are still alive in South Korea. And then so this is just a distribution of HIV and AIDS patients by their gender and their age. So as you can see here, the greatest percentage of HIV and AIDS patients in Korea are in their 30s. And this is the percentage of males and females who have AIDS. And then this is some of the ways, some of the infection pathways through which HIV and AIDS patients got their disease. So as you can see here, there are several ways that they got their disease, and then this just shows the percentage and the number of patients. So I would like to start by mentioning the literature review that I did as part of my study. And then so in 1997, Kwan reviewed the background of the AIDS prevention law. And basically what this AIDS prevention law is that the government, in the 1990s, the government, because they first were aware of AIDS and the nature of the disease, the government made a law highly limiting the human rights of AIDS patients. For example, AIDS patients were forced to report their status to the hospital or to the government, which caused their AIDS status to be leaked out to the public. And as I mentioned before, Korean society is highly closed-minded. And then so if for example, if you have AIDS and other people around you, or your friends, or your coworkers, or society, if they find out about your status, then they will tend to highly isolate you and not want to interact with you because of the close-minded nature of Confucianism. So as you can see, the AIDS prevention law caused a lot of human rights violations of AIDS patients in Korea. And then so Kwan just wanted to review the AIDS prevention law and whether it was appropriate in the context of South Korean culture. And then in 2004, Kim, he dealt with the human rights and the right to health of HIV/AIDS patients. And in 2003, the Korea Federation for HIV/AIDS Prevention surveyed adults' perception of HIV and AIDS. So they surveyed what the adult public thought about HIV and AIDS patients. And then in 2005, as I mentioned before, the National Human Rights Commission of South Korea, they conducted a survey of 255 HIV/AIDS patients in Korea to determine how severe and how